morning, everyone. Thank you all so much for joining us here today. I can't tell you how excited I am to open this vaccination site right here in Moscone Center. And let me just take us back a little bit. When this pandemic first hit our city, our country, about a year ago, in San Francisco, we had to get ready. And as much as Dr. Colfax and I fought over what was going on and whether or not we needed to close down the city because we understood the significant impacts on people's lives by making these hard decisions, we knew it was the right thing to do. We knew it was the right thing to do because it was about saving lives. And when you look at where San Francisco is in terms of our death rate, even though every life loss is tragic, we are the second densest city in the country with the lowest death rate of any major city in the country. We save thousands of lives in this city. And it started right here at Moscone Center. And I want to take this opportunity to really thank the Director of the Department of Emergency Management, Mary Ellen Carroll, for her hard work, and the people who came here to work, not only the folks who work within her department, but so many city employees who signed up as disaster service workers, who answered the call and who have been showing up to deal with challenges around this pandemic. Whether it's homelessness and resolving encampments, whether it's testing and getting testing sites set up all over the city, whether it's information because people were confused about what was actually going on, the people in Moscone Center who have been showing up every single day for the past year, the sheriff deputies, the fire and police department, the librarians, the Department of Public Works, people from all over the city, they are the ones who have been leading and managing this effort, and we are so grateful for their work. And I know that no one is more excited than they are that we are finally at this place to deliver this vaccine at the same place where we have been managing this crisis in San Francisco. And what I am so appreciative about is this consortium, led by Kaiser Permanente, to open up this vaccination site where we will have the capacity to deliver 7,000 to 10,000 doses per day. San Francisco has a goal to deliver at least minimum 10,000 a day. This one site on its own can basically do that, but we're not stopping there. We're opening a site in the Bayview. We've opened the site at UCSF, with UCSF at City College. We have Maxine Hall in the Western Addition. We have a small Bayview site open now. We opened a pop-up in the Mission, the community which was one of the most impacted communities as it relates to this virus. And you know how we're doing it? We're working together. The Department of Public Health, led by Dr. Grant Colfax, the healthcare providers that are a part of this consortium, we have all come together because we know how important this is to reopening our city. We've saved lives, yes, but we know there are still challenges, not just with our economy, but around mental health. Our children are not back in school. People are not back at work. Folks have lost their jobs. We know how critical the rollout of this program is. And the reason why it's going to be a success is because of each and every one of you. And so I am grateful that all of you are joining us here today. And I do want to take an opportunity to recognize a few partners of the consortium, because sites like this don't just open because we say we want them to open. They open because of people who help to put together the refrigeration systems, the transport systems, the staffing, the doctors, the nurses, the clinicians, the people who are going to check folks in. There's so much that goes into setting up even a small site, and we have to make sure that the logistics are just right so that we do not waste one vaccine and so that we get these vaccines into the arms of the people who need it the most as quickly as possible. So first of all, thank you to Dr. Colfax and the Department of Public Health. In partnership with Kaiser Permanente, we are so grateful to Kaiser and what they're going to be doing at this site. And I want to just also reiterate, this site is not only for Kaiser patients. They will be helping with people 65 and older at this site. And they'll talk a little bit more about how you sign up because we wanted to make sure that we had an accessible site that was this large citywide to make it easy for people to get vaccinated. Adventus Health, thank you so much. Thank you to Dignity Health. Thank you to Futuro Health, the California Medical Association, and the Primary Care Association. All of these various healthcare providers have come together to make this site available. It officially opens Friday at 8 a.m., and the normal hours will be 7 a.m. to 7 p.m. daily. As long as we have the vaccines, we will have the places in which to distribute them as quickly as possible. So again, I want to thank all of you for joining us here today. We are looking forward to what the future holds in San Francisco. We are getting the vaccines out as quickly as we possibly can. Nothing is more important. And this major site will play a significant role in getting our city to a better place. I don't know about you, but I'm ready to celebrate. Not today. I'm ready to celebrate in a few months when we're able to say that the city is open, that the city is open for business, that we can do things in and outdoors, that we can finally, eventually, one day, Dr. Colfax, take our mask off and wave them in the air like we just don't care. I don't know about you, but I'm looking forward to that day, and that day is coming. But let me also just say, I appreciate the people of this city so much because you followed the health directives in most cases. You wore your mask, you kept your distance from people, you didn't get a chance to visit your family and your friends the way we're used to doing. We sacrificed so much. And we're gonna need to sacrifice just a little bit more because we are almost there. I can feel it. Today the sun is shining. And I can feel the energy and the excitement about the future of this city. I can feel the energy of the conventions that will be returning to Moscone Center, the people who will be going to restaurants both in and outdoors, the folks who will be taking their children to school, the people who will show up to work and be able to congregate with one another in the lunchroom. Some of the basic things that we miss so much, I feel it. It's gonna happen. But we're gonna need to sacrifice a little bit more. And in addition to sacrificing, we will do everything we can to roll out these vaccination sites, advocate aggressively to get more vaccines quickly, get them to the people of San Francisco, and open our city back up to celebrate again. Thank you all so much for being here, and at this time I want to turn it over to Dr. Grant Colfax of the Department of Public Health.
Well, good morning, everybody. This is an exciting day, a very exciting day, a good day. And I have to say, when I woke up early this morning, my husband said to me, "You seem so happy today. What's going on?" I said, "This is a day that will make a difference in San Francisco. This is a day of partnership, of collaboration, of pride of what we can do together when we come together as a community of people, of clinicians, of people who work hard on the operations and logistics to get this done." I was here Monday. I started seeing this going up. the progress has been amazing. Look at this place. We're going to be able to do up to 7,500 people vaccines a day. And I just want to thank Kaiser so much for your partnership. This conversation started a while ago. Ron, thank you for your collaboration and partnership at the Hospital Council to make this happen. And of course, thank you, Mayor, for your leadership during this incredibly challenging year. Your courage, your fortitude, and your leadership in helping us slow the spread of the virus. Our partnerships with healthcare providers are critical to meeting our goal of vaccinating everyone who lives or works in San Francisco in order to bring an end to this pandemic as quickly as possible. These high-volume sites will help us serve people and it would not be possible without these key partnerships. And as you know, although vaccine remains in limited supply, we are building the partnerships and the infrastructure so that when vaccine is readily available, we are ready to go. 10,000 vaccines a day in San Francisco. We can do that now. We can do more than that soon. We are building a comprehensive vaccination network with a variety of options for all those who live and work in San Francisco. And this system is focused on equity, speed, and access. The Department of Public Health, its community partners, also will continue to vaccinate people through community clinics in the Western Addition, Chinatown, Bayview, Outer Sunset, and Potrero, where we know this virus continues to spread. And we are working to expand our neighborhood access sites to the Bayview, Excelsior, Visitation Valley, and other neighborhoods with the highest infection rates of COVID-19. And we are working with our pharmacy partners to bring vaccines to locations throughout the city. It's really an all of the above approach to focus on the speed, the access, and most importantly, as we have seen during this COVID pandemic, equity. Our work with community and healthcare providers has been an integral part of our COVID-19 response, and today's announcement highlights that importance. I'm so glad I could be with all of you today and recognize that work. And with that, I'd now like to hand this off to Janet Liang, Kaiser Permanente Executive Vice President, Group President, and Chief Operating Officer of Care Delivery. And finally, as a Kaiser patient myself, thank you.
Thank you. Thank you, Mayor Breed and Dr. Colfax. I was thinking this morning about how February 2020, a year ago, Kaiser Permanente was preparing for greeting the very first COVID-19 patients into California that were coming from the Princess cruise ship. And it has been quite a year for all of us. And throughout this year, we have constantly asked ourselves, how can we do more? And this site, this hub, is an example of coming together, doing more together to create something that would not have been possible without all of us working together. This is the largest mass vaccination site in the state of California with a 10,000 a day capacity, only limited by vaccine supply. And I want to thank so many people here who helped, and of course the city and the city leadership for offering Moscone Center, which is a perfect location and type of venue for this type of mass vaccination. I'd like to thank our state leadership, the governor's office, the Department of Public Health, for not only providing a vaccine to Kaiser Permanente for Kaiser Permanente members, but also for believing in the vision of the consortium to provide the vaccines so that we could help vaccinate the general public. And I'd like to, of course, you're going to hear later today, the consortium partners, Adventist Health, Ventura Health, Dignity Health, and our planning partners who are here today, California Medical Association, the Primary Care Association, and the Red Cross. The Red Cross lent their experience to us in terms of mass vaccination planning. And it's really together that we are so pleased to bring the hubs to the public. These hubs answer the public's call for immediate and meaningful vaccination. The hubs also represent the consortium's values, our mission to vaccinate the most diverse and broadly reached populations. It was important to us that in our planning that no one is left behind. And so in the surrounding areas of Moscone Center, we've reached out to community health clinics, such as the Mission Neighborhood Center and Health 360. We've reached out to senior centers, such as Onlock, and we've reached out to homeless service providers, such as the Provider Resource Center, to ensure, again, that no one gets left behind. Now, Moscone Center is our first hub, but I also am excited to say that tomorrow our second hub opens in Cal Poly Pomona, serving with the exact same mission and serving the exact same need to vaccinate efficiently and equitably across our different markets. And these hubs use the state's My Turn scheduling and appointment system. So I want to thank the state for quickly putting that together in order to make it possible for the general public to get vaccinated. And we, on all of the sites, our eligibility defaults to county eligibility requirements. However, I will say that our hope, one of our aspirations, is that we can get to as many 75-year-old and up individuals as possible, because 75-year-old up just represents a subpopulation of the 65 and older at most risk for impact, long-term impacts from COVID. And again, these hubs are the largest in California, and we plan to be ready for when vaccine is available. You know, someday soon there will be much more vaccine, and it's really important that the state of California is ready with efficient ways to vaccinate the public. And so we are actively working beyond these two sites to explore additional locations throughout the state of California. And we're doing our part to do more on behalf of saving lives of the people of California. So thank you very much for being here today. And I think I don't recall who's, oh, Keisha from Dignity Health, please come up. Thank you.
Thank you so much, Janet. And on behalf of Dignity, it's such an honor to be able to be a part of this incredibly important initiative, to be able to improve the healthcare of our community, the health of our community. So we are very grateful. It is a wonderful day, and we are so proud to be representing the Consortium of Healthcare Organizations, coming together for a common cause, and that is to make our communities more healthy and to get on the other side of this pandemic. What an absolute honor to be a part of this. The goal for this unique partnership among a consortium of statewide health organizations is to eventually stand up a network of hubs across the state, which will serve as a model for similar efforts in other states as well. So I'm just excited personally to be a part of this and helping to make history. Locations will be chosen to maximize access, especially for communities with populations who have historically experienced challenges with respect to health and healthcare access. In Dignity Health, we always talk about reaching the disenfranchised and the poor, and this is directly in line with our mission of our organization. The Moscone Center's spacious and accessible location is part of a network of high-volume vaccination sites organized by the City and County of San Francisco and healthcare providers. This consortium will enable partnering healthcare organizations, such as ours, Dignity, to leverage resources and staff, align our operations for efficient and safe vaccine delivery, and offer convenient parking for patients if needed. As part of this collaboration, we will remain committed to getting the COVID-19 vaccine to the community in accordance with state guidelines, equitably and as vaccine supplies allow. So at this time, I'd like to hand it off now to Andrew John, President of Care Delivery at Adventist Health.
Thank you, Keisha. Thank you, Janet. And thank you, Mayor London Breed. What an inspiration and what a privilege to be part of this today. My name is Andrew John. I'm the president of Care Delivery at Adventist Health. And I just want to say on behalf of Adventist Health and the 80-some communities that we serve, thank you to healthcare workers all across this state for your continued heroic response to care for Californians in this unprecedented pandemic. Thank you, Mayor London Breed and our consortium partners for the heavy lifting, the coordination, and the investment that's made today's model possible. And I want to say a special thanks to my colleagues at Kaiser Permanente for taking an early and leading role in organizing this consortium. Somebody needed to step up. Kaiser was there, and I'm proud to be a part of that, as well as Adventist Health is proud to be a part of that. Thank you for bringing us together, because it's together that we're going to beat this pandemic. Today's mass vaccination hub serves as a roadmap and a model for how we're going to eradicate COVID-19 from the face of this earth. It's a model for restoring health, a model for restoring wholeness, and a model for hope. I'm going to turn it over to my friend and colleague, my new friend and colleague, Vaughn Tone Quinlivan, who's the CEO of Futura Health. Thank you so much.
Thank you so much. Futura Health is delighted to be standing with this consortium and Mayor Breed in this important work for our communities. We see this vaccination as an essential step in the recovery of the nation and of the state. In addition, we see this as an opportunity for students who are in allied health and nursing programs across the state to gain patient care experience, so important for them to getting their licensure. In this state alone, California needs an estimated 500,000 new allied health workers to be on the front line of caring for the growing and graying of California. So this is such an important experience for them, and we invite you to help us get the word out to colleges that they can participate in this opportunity. Thank you. And now I'd like to introduce Dr. Maria Ansari, who is Physician-in-Chief of Kaiser Permanente, San Francisco.
Thank you. I am privileged to serve as the Physician-in-Chief at Kaiser Permanente in San Francisco. On behalf of our physicians, our nurses, and our entire healthcare team, I want to welcome all of you to this mass vaccination hub. We have seen firsthand and up close the impact of COVID-19 and the toll it's taken on our community, particularly affecting and disproportionately affecting our communities of color. I want to take a moment and sincerely thank Mayor Breed and Grant Colfax on their work. Their actions saved lives. Their actions preserved ICU capacity. Their decisions made it so we never ran out of ventilators in our ICU. I am so lucky, and our colleagues across this city feel indebted to you. You have made a difference here. Finally, due to the miracle of science, we have some hope, the advent of a safe and effective vaccine to end this pandemic. And it's just a delight to be able to talk about building immunity in this great city. So let this vaccine hub be a hub and a beacon of light and hope for the future. Today is a day to celebrate. Kaiser Permanente has a long history in prevention and in vaccine delivery. And together with this consortium, we're going to build on that expertise with this partnership and really expand, broaden our delivery of vaccines across this great city. We will, and we are committed to an equitable distribution of vaccines to our community. we will be focusing on the highest risk for complications from COVID-19, specifically in our elderly and in our communities of color. Let's not forget, though, that until we build full immunity, we will continue to wear masks, to keep our distance, to wash our hands until we have eradicated this disease. That is why it's important that we do this efficiently and broadly, starting with our most vulnerable populations at risk. Since we started vaccinating a few weeks ago at our medical center, I have had the pleasure of seeing my colleagues in healthcare and our elderly get vaccinated. When I ask our doctors and nurses if they've had any side effects from the vaccine, what they usually tell me is nothing but pure joy and overwhelming relief. That gives them strength to carry on during this continued ravaging disease and fight this final surge, hopefully. I'm also meeting with seniors in our community who are coming out of their homes for the first time in 9 or 10 months. They tell me about their hope to see their families again and to hold grandchildren, some of them for the first time. Today marks the end of social isolation. It is the beginning of the end. It is the end of a raging pandemic and the beginning of restoring health and healing to this great city. Thank you for this opportunity to deliver an injection of hope into our community.